Community Health Center of the North Country operates 4 federally qualified health centers across the North Country here in New York State. One of the bright spots that has come out of the pandemic, which I know on the surface sounds kind of odd, is the use of telemedicine. Here in rural America, where there's transportation challenges that most people wouldn't be able to comprehend in urban America, it's a game changer. I think one of the places where we've seen the biggest change with the use of telemed is probably in our behavioral health and substance use care coordination service lines. There's still, I think, a stigma attached to someone coming into the facility for a behavioral health appointment or a substance use care coordination appointment, and it stops a lot of people from reaching out for care. With the advent and use of the telehealth platform for those visits, we saw a huge ramp up, not only in quantity, but maybe even more importantly, a dramatic drop in no-shows. For people with intellectual and developmental disabilities living in our houses or just receiving other services we provide for that community, obviously there is a whole unique set of challenges for them and their caregivers when it's time to come to any type of medical appointment. If they can get those checkups, get those check-ins, get some of that preventive work done on a virtual platform like we are doing now with telemed, it's a great way to keep people as safe as possible, but not avoid the care that you need to stay healthy in other ways.
On the WebEx platform, we are able to connect with people in the outdoor recreation program, provide people personal training, and connect with students in the elementary schools throughout the North Country. To be able to see that people are learning new skills on these online platforms has been very rewarding.
There is a huge shortage of dentists. In St. Lawrence County alone, there's one dentist for about every 3,000 residents.
We have been able to render in the neighborhood of 1,000 teledental visits in the last 12 months. Visits that otherwise wouldn't have taken place thanks to the telemedicine, teledental equipment and capabilities that we have. The thing that's been most exciting recently is along the lines of that diagnostic work, we're performing limited evaluations for people who are having an acute problem, whether that be swelling, pain, something broken, whether that be a tooth or a filling. My team and I are able to diagnose and offer treatment modalities to the patient to get them out of pain and help them to feel confident that there's a way out of this dental emergency that they're experiencing.
It's all about providing equitable access to care, to be at an organization that helps build healthier communities, not through just access to healthcare services, but in other ways. It does make you very proud. Working with Aspire has been critical for us in ramping up our telehealth, telemed platform. We don't have the internal resources to do that all on our own. So to be able to have the expertise of a team at Aspire made a world of difference.